Next question is from Junior from Atlantic, Iowa. Junior writes, what can we do about the high cost of health care?
Well, high cost of health care. First of all, let's be honest about something. We don't have a health care system in America. We have a sick care system. I have been talking about this for years. And until we fundamentally understand that, all we're going to do is just chase the problem and throw good money after bad. Because you see, we have this sick care society. If you get sick, you get care in America, one way or the other, emergency room or some other way you get care. All the incentives in this country are to patch, fix, and mend once you get sick. Very little incentives on the other side to keep you healthy, to keep you well, to prevent illnesses. But that's where the incentives ought to be. So I have legislation in the Help America Act to do that, and I've been trying to get this done for a number of years to put more emphasis on prevention and wellness. And it starts with our kids. It starts with how they eat in school, making sure they have healthier foods in school, making sure kids have decent exercise, make sure they get their immunizations and vaccinations, things like that. Smoking cessation programs. We need to provide tax breaks. You want to give tax breaks to businesses? I'd give businesses all kinds of tax breaks if they put in wellness programs for their employees. Free annual checkups, for example. Exercise places for their employees. Time off for them to exercise during the day or to belong to a health club, that type of thing. The elderly, making sure our elderly have decent nutrition, diets, exercise. Again, checkups, periodic checkups. So we've got to get to a prevention and wellness society. We do that, then we can start controlling the high cost of health care. Right now, about 75% of all the money we spend on health care goes for chronic illnesses. Most of them are preventable. So my answer to high health care costs, first of all, let's start shifting our focus to prevention and wellness. Secondly, let's have a national health care system which puts everybody in a pool, in a large pool, so that the cost per person comes down. And third, in a transition to that, we need to expand the children's health insurance program to make sure the minimum we ought to be doing in our country is to make sure that every child from 0 to 18 is fully covered with health care. But again, making sure that the incentives are in keeping you healthy and preventing illness in the first place.